Hi everyone, welcome back to my channel. This is Kat. Obviously, as you can tell from the title, in this video I want to share some of the jobs that in healthcare get paid over six figure. And these are definitely, something that I want to share with you so you can go along this path if you're thinking about switching career. And of course, I'm not going to mention any jobs that require doctorate degree, including, for example, obviously all the medical doctors, any position or any specialty, even the general family doctor get paid way over six figure. We're talking about, over 100,000. So that's definitely not included here. Other doctorate degree, including dentists or pharmacists, they're all not included in this list because obviously they get paid over 100,000. Another category that I'm not going to mention in this video are all the jobs that I've mentioned in my previous videos that are closer to finance and require PhD degree as well. So for example, MSLs, I'm not going to mention it because they also get paid pretty well, or consulting or private equity, If you've watched my videos, obviously those are the topics they always talk about, so I'm not going to include in this video. So in this video, I want to kind of use my experience as well as what I've heard from my friends who are in those fields who get paid over 100,000, and then I kind of collect all the data and want to share with you in this video. And of course, the bare minimum, if it's in healthcare, all of them require a bachelor degree, and some of them do require another kind of 2-year education above and beyond the bachelor degree. But I think that's a little bit doable compared to, doctorate degree, which costs a lot and consumes a lot of time. It's at least 4 years. So if you're new to my channel, I'm Kat. I have a PhD and obviously in healthcare, I share a lot of information regarding the healthcare job market and different career paths other than academia. So if you're interested in such content, please don't forget to subscribe. Let me know if you like such content about the job and the salary status. Thumb up the video so I know that, and I'll make more such content available to you. Without further ado, let's get started. So first and foremost, I want to mention is physician assistants. This is a job that requires 2 additional years of education after you get your bachelor degree. Okay? But as you can tell, it is a physician assistant. It's not a physician per se. That's why it doesn't require 4-year medical school training plus the residency, which requires another 3 to 7 years. It is a job that you kind of get right after you get your PA degree in a school, which are typically a medical school. And right off the bat, you're only 24, 25, you're already making a bit over 100,000. So the median salary for a physician assistant is 130,000. And this could vary by specialty, right? And the things that you do are very, very similar to what doctors are doing, but at a easier level, if you understand what I mean. So let me give you an example. So I was pregnant with my baby this year, and throughout my pregnancy, I have to go to an OB-GYN, which is a doctor and specialized in gynecology, right? I want to do my checkup to see how baby's doing, how I'm doing throughout my, almost 9 months of pregnancy. And every month, pretty much, and more frequently later during the 3rd trimester, you have to go to the doctor. But to your surprise, you don't actually see doctor every single time. So as you can see, it's more like a routine test, right? You want to check to see, if you're okay, if the heartbeat of the baby is fine. Maybe you do ultrasound, which is performed by a technician. The result will be interpreted by a doctor, but also could be a physician assistant. So for example, at least in my case, my OB and physician assistants kind of rotate. So let's say this month I went in, it is my actual doctor OB that, checked up to see if I'm doing okay. The next month when I go in, it's actually the physician assistant. So she would do the same thing as my OB does. So she would ask me if I have any questions. She can answer all the questions pretty much I have because she has over 20 years of experience. But even she doesn't, actually, once both my OB and my PA were on kind of vacation and family emergency, I had to switch to another kind of OB. And actually, I was seen by a physician assistant as well. And she was pretty young. She can also, do the routine checkup and answer all my questions. So if you are interested in medicine, but don't want to spend all the money and time in medical school and post-medical school training, physician assistant is a very good choice. Next position will be sales. It is a little bit surprising, maybe to you, or not surprising, because any sales make good amount of money, actually. So if you're postgraduate, undergrad, and then you want to find a job that makes a lot of money, sales should be where you go. And this just happened to be in healthcare. And this could be an account manager in a large CRO or a technical sales in a biotech company. Regardless if you're in charge of certain accounts or territories, as long as you're in sales, your salary structure is starting with a base salary, which is typically, if you're literally right after your undergrad, you're like 22, 23, and then you're going to sales, your starting salary or your base salary is definitely less than 100,000, right? But it's not that off because your total package includes your commission. So you have a base salary and then you have a commission on top of that. You have to, find a company that actually offers a target that is achievable. Because a lot of companies, they set up a really high target that, you really cannot reach that target in order to get commission. And of course, that's why you talk to people and do informational interviews. But many CROs, they do set a reasonable goal. If you achieve that, you get certain commissions. And of course, it can get higher if you do more sales. So sales is always a good position to start if you want to make money fast. And if you have this personality that you are very good at sales, then go for it. But even the most shy person can do sales. You'll be surprised how good you will be at sales if you train yourself. So even though I say it's, 100,000 starting, but if you are very good at sales and after a few years of experience and increasing your base salary, the sky is the limit. The next position, going back to the science side, is being a scientist in a biopharma company. So if you're just a technician, of course, the salary will not be six-figure. But if you actually are a scientist in a decent-sized biopharma company, your salary can easily reach 100,000. Of course, you're competing with people who have PhDs or postdocs even. But what I'm talking about is if you only have undergrad, or if you have, a year or 2 years of the master degree, with a few years experience, of course, you can get 100,000 just after 2-3 years. Versus if you think about it, for someone who need to do PhD, that's another 5-6 years easy on top of their undergrad. And not to mention if they didn't do any gap years and they're already, let's say 30 versus you are only like 25. The next position I've mentioned in some of my videos, kind of buried in the list, is the medical writing. So if you become the editor in a scientific journal or medical journal, you do get paid a decent amount. And of course, again, I'm not talking about right after you join the journal. It does require a few years of experience, and then you kind of climb the ladder to become an editor. And it's not as slow as you think. It's not, in the TV shows that you have to wait until all these boss, like the chief editor or editor, to retire for you to be the editor of the journal. For a scientific journal, there are many, many editors. So as long as you're good at writing, understand the language, with a few years experience, you can get editor position as well. Next position is data analyst. I don't even have to, explain too much. Data analyst is such a hot position right now. So even though you don't know anything about data or analysis, you spend a few weeks in kind of like a boot camp for data analysts specifically, you can get a job right after. I think the trend is very much like computer science. A few years back, you kind of participate a boot camp for, let's say, 6-8 weeks. You learn how to code and you go for interview and you get a good job. Same thing for data analysts right now. If you just want to do some data related work, you can join a bootcamp with zero experience, 2-3 month thing. You're ready for a job interview because those are very technical jobs. You don't really need to have very good, let's say, presentation skills, communication skills. As long as you pass those kind of technical exams and very good at it, very few behavioral questions later, you will get hired. And a year or two later, your salary will exceed 100,000. And I'm just talking about, a smaller company. If you're a big company, as soon as you're hired, your salary is over 100,000. Next is healthcare administrator. That's actually something I've never thought of until one of my graduate school friends went into the administration position. So it's kind of all under the administration umbrella, but of course you're working in a hospital or a hospital system. And you can also work at a grad school that is focusing on healthcare, but have some hospitals affiliated with it. But overall, it's kind of the healthcare administrator role. So if you're interested in organization, a lot of administrative stuff, this is a very good position for you to go in. You can still work closely with healthcare staff or students without the burden of doing science, doing bench work, or dealing with a lot of data, or dealing with patients, right? So it's a lot like accounting, right? So you're dealing with paperwork in front of a laptop. It's very office kind of work. So if you like that, that's a very good position as well. And at least my friend who, went into that position is currently really happy with it. She's not in Texas where I'm at. She's in, Washington State right now. Oh, she get paid over 100,000. But I think across the country, as long as you have a few years of experience, you do get paid over 6 figures. Lastly, probably you've already know that, is the traveling nurse. So nurses, at least in Texas, don't get paid 100,000 right off the bat. Okay, so you might need quite a few years of experience, senior enough to get paid at 6 figures. Unless you're a nurse practitioner, which is a different thing. You need different certificates and education for that. But if you're just a nurse right after the nursing school, in Texas, you don't get paid that much. But if you're a traveling nurse, that's a completely different story, okay? The per hour rate for traveling nurse is like any traveling job, but because I'm in Houston, and many of my friends, they work in oil and gas field. So if you travel to oil and gas, actual field to work, or traveling electrician, or traveling any other blue collar work, you also paid over 6 figures. So it's very similar idea, but just get paid a lot more if you were a traveling nurse. Especially during the COVID time, traveling nurse was such a shortage, and they get paid way over $100 an hour, sometimes 200. Of course, now the rate is coming down, but still it is a 6-figure job if you are willing to travel. Obviously, you know that this is a job that you have to be away from the home, a few days a week. But if you're young, passionate about nursing, and still don't have many family burden or attachments, that is a perfect job for you. So that's it for the video. These are the 7 healthcare jobs get paid over 100,000 based on my and my friends' experience. If you have anything to add, please comment below. So I also learned what other good jobs that get paid well, so I can share with all of you guys in the future. If you like such content, don't forget to thumb up and subscribe to my channel. Thank you so much for watching. I will see you next time.